Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. But let's begin with the illusion of the week. Okay, this is a real simple illusion you can do with a borrowed pencil. If you see somebody writing with a real sharp pencil, say, may I borrow that for a minute because I have some sinus congestion. And then take the pointy end and just push it into your nose like this and all the way up and around. Work it around and then pull it back out. Wipe it on your sleeve and give it back to the person that loaned it to you. Chances are they don't want to keep it. Here's how you do that. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Okay, now let's talk about how you can improve your endodontic access. I promise it will be a lot easier than shoving a pencil up your nose. Proper access preparation is the key to uneventful and successful endodontics. So today's tip is going to show you how you can minimize your access opening while making certain that you go straight into the canal. Unimpeded straight line access is going to be the key to proper preparation. A couple of errors that you may make with access. If you make your access too small, you're going to miss canals and you'll have a very bad file path. Too large and you weaken the tooth itself. For years we've been de-roofing the pulp chamber and making the walls divergent and over-enlarging our access openings. I'm guilty of suggesting in the past that you should make your access opening so when you close one eye you can see all of the openings at the pulp floor. You don't have to do that anymore, and this is the old style. When you would go in and make a large access opening, and the distal canal on a lower molar does not have to be opened up as large as we have in the past. And I'll show you what I'm talking about right now. Our goals for today is open into the pulp chamber and large enough to get good straight file path into the canal and to maintain as much tooth structure as possible while we're doing that. This is the old technique. We would go in, we'd open up and straighten everything out, and it looked like we were getting straight line access into the mesial, which we are, as you see here. But when we go to the distal canal, if we go straight in, it's obvious that we have over-enlarged that distal. So what we want to do in the future, instead of going in at that angle, open it only up to the point where you're lined up with the canal itself. And this blue area you see right here is the area that we're going to leave. That's tooth structure we don't have to take away. As we see with the green arrow on the mesial, we have in the past been enlarging the mesial pretty well, but you don't have to go past the midpoint in the tooth itself in order to get good straight line access into the canal. That's the new way. The old way is shown here. The red line shows that in the past we have taken away too much tooth structure and not gone straight into the canal. So by limiting our access to the middle of the root or just slightly beyond the buccal groove, we now find that we can have straight line access into that distal canal and still maintain the majority of our tooth structure and have our access look like this. And finally, let's talk about when and why we might want to reduce the occlusion as part of our access opening. Now, personally, I believe that we only reduce the occlusion if the patient comes in and they have pain on biting and the tooth feels a little high. Other than that, I don't think we need to reduce it at all. But if we do reduce the occlusion, let's keep it to a minimum. I think this is probably a little bit excessive right here. And if you do decide to take off the occlusal surface, maybe you'll reduce 1 millimeter or 2. But there is some advantage to doing that. If you reduce the occlusion about a couple of millimeters, it guarantees that you'll have no hyperocclusion between appointments. You also will have a much better visibility. The light gets into the chamber a lot easier. You don't have to worry about breaking off a cusp between appointments, and the patient never changes their mind and says they don't want to get the root canal. But of course you need to clear that with the patient in advance. Anyway, I hope you've enjoyed our little session on access opening. And if you'd like to learn more about it, please come to one of our root camps, and there's information at our website at EndoRootCamp.com. Well, that's it for another edition of the Root Tip of the Week. I'm Dr. Kit Weathers, and I will see you at the next Endo Root Camp.